I would like next to introduce Mariya Patwa, who is a public health practitioner and researcher serving as the current treasurer of the board of directors of Our Bodies, Ourselves. As an undergraduate student at Wellesley College, she partook in the Madeleine Albright Institute for Global Affairs and conducted research at the Wellesley Centers for Women. Last May, she completed a public health degree focusing on international health systems and maternal and child health at Johns Hopkins University. During this program, she worked as a graduate student research assistant based in Johannesburg to promote the integration of safer conception services into routine care for people affected by HIV. So, Mariya, please.
Thank you all. Can you hear me? Is this okay? Perfect. Thank you all for coming and joining us today. I guess my biggest thanks first goes to Judy and Miriam because I am so excited to be a part of the history and legacy of this organization and be a part of kind of the today efforts and tomorrow efforts that we're moving forward on. One of the things I keep telling my family is that Judy and Miriam are like encyclopedias. They know everything, and they just, I mean, I've learned so much in just the several months that I've been a part of the board, and I'm really grateful to be a part of it. So I'll tell you a little bit more about my story, where I've been, why I'm here, and what I hope I can do. And so as Amy shared, I went to Wellesley College undergrad, and I was a very eager pre-med student, chemistry major, and then Wellesley hit me. And I took a class with Susan Reverby in the Gender Studies department, and I took an American healthcare history where I read the book, The Making of Our Bodies Ourselves, I believe by Kathy Davis. And I think from there I started questioning a lot more about what I understood about health, what I understood about women's health specifically, femme health, gender identity and sexuality, and reproductive rights. And a course that I took with a woman named Dulce Natividad from the Philippines was a seminar focused on colonial medicine and public health, which really had me thinking about, you know, what are our health systems built on? What is the history and legacy that we need to be critical of, and what we need to be thinking about constantly when we engage in public health, when we engage in medicine, advocacy, both within the US and elsewhere. So that set me off on a path of applying to the Madeleine Albright Institute for Global Affairs. And I was assigned to a project to engage on the Millennium Development Goal of ensuring healthy lives and promoting well-being for all. And so that the questions that we asked really had me tackling the kind of key problems about health systems development and what that framework and history is built around, and inspired me to engage more in global health, and led me to Johns Hopkins to do a degree in international health systems and development. And with that, I was able to work and travel both in developing countries, and including South Africa and Guatemala, and come back and realize that it's really applicable here. And so right now I'm working with the Cambridge Health Alliance. I work for two research teams. One is focused on the Children's Health Initiative, which really is working on enhancing systems of care for families. And you know, we work with family navigators and family advocates within the healthcare system to better integrate behavioral healthcare services for children and their parents, and as well as working with the Biobehavioral Family Studies Lab, which is engaged on maternal and infant stress and attachment behaviors. And this is all to say that I really like to engage on and think about the way that we improve and strengthen healthcare systems, both to support and improve women's health, but also to kind of think more globally and at the household level, which is truly where I think healthcare begins. And you know, it's the family units, the community units, the health systems and health policies that we have to be advocating for from all ends and corners. And I'm really excited to be a part of Our Bodies Ourselves right now, where we're really promoting the work that other organizations are doing, carrying on that legacy, and supporting organizations that are doing the good work in their own communities.